Good evening and welcome to Healthline. I'm Tara Brantley, morning and noon anchor at WANE TV News Channel 15. And tonight it's my pleasure to be your special guest host for Healthline. This evening we're going to discuss a sensitive medical problem, bleeding fibroids, what they can do to your body and how to treat them. And we hope you'll take time to call in to pose questions to our medical expert. Tonight we're talking with Dr. Geoffrey Cly. Dr. Cly, thanks for joining us tonight. Let's start with a really basic question.
Sure.
What are fibroids and what causes them?
Sure. A fibroid is a single muscle cell in the uterus, smooth muscle that grows out of control. And we really don't know exactly what causes them. We know they are more common in different types of and races of people. And sometimes they can grow to be 1 centimeter, and sometimes they can grow to be 6, 7 centimeters, even pounds.
Are they more intense during a woman's menstrual cycle?
Absolutely. If you think of having something inside a muscle, when the menstrual cycle occurs, the muscle contracts, and the uterus contracts against this foreign object, which is the fibroid, and causes intense pain and bleeding.
Okay, so you're on your menstrual cycle, and that in itself brings about pain,
Yes.
as we all know.
Yeah.
Then you have that compounded with fibroid problems. How can you tell if you're just having a regular menstrual cycle with the typical cramps, or if you have a fibroid problem as well?
Usually by looking at your history, and most of the time once fibroids are beginning to cause problems, there's a change in the cycle, whether it's pain or bleeding or intermenstrual bleeding, meaning every couple weeks you might have some bleeding or spotting.
Are you able to actually touch your abdomen and feel any type of extra pressure? Or no?
If they're large, you can. And most of the time people come in when the change starts, so that's before they can feel them. But we have had people come in and have the size uterus that's as big as a 9-month pregnant uterus.
That must be incredibly painful.
Yes.
Wow. Okay. Is there any non-medicative method we can take to alleviate some of this pain?
Not too much to do without any type of medicine. There are some over-the-counter remedies that will help alleviate some of the bleeding symptoms and the painful symptoms. Advil type of products work very well. And then there's some medical or medications that will help also decrease the bleeding and the cramping, such as birth control pills or other types of hormone pills.
How can you get rid of fibroids?
The only way to truly get rid of them so that they don't come back would be some type of a surgical method. And there's one method called a myomectomy, which is removing just the fibroids, leaving the uterus, which is really good when a woman wants to retain her fertility and have children in the future. And then the other method is a hysterectomy, removing just the uterus, not the ovaries necessarily, but just the uterus that contains the fibroids.
With either of those procedures, is the incision fairly large?
It depends on how it's done. Traditionally, it was done with a C-section type of incision, about 7 or 8 centimeters, which required 6 weeks before you return to normal, return to work. Now, I'm very excited, there's a new technology. The Vinci system allows us to do this with small 1 centimeter incisions. And so a woman can go back to normal in a week to 2 weeks and back home in the same day or the next day.
And you yourself have actually performed this procedure.
Yes.
What's involved with it?
The system in the procedure, regular discussion of risks, benefits, examinations, making sure it's appropriate for the patient. And then it's an outpatient or a 23-hour procedure, and it involves a laparoscopic method with a system that allows us to put 4 instruments inside. Each of those are 5 millimeters. And we're able to work inside the abdomen as if we were outside with our own hands. So it takes our large hands and movements and miniaturizes them to 5 millimeters.
It's a fairly new procedure.
It's fairly new. It's been around since 2001. In Fort Wayne, we've had the technology for about 2 years, and for gynecology and hysterectomies, about a year.
And we do have some video of that procedure. We're going to put it up on our screen now so that our viewers can actually see it being done. Please describe for us what is taking place.
Right now you're seeing the surgeon there at the console on the left side, and that's where we perform the procedure through the high-definition virtual reality glasses. And the technology and the robot is on the right. You're seeing now the instruments. I position the instruments inside the patient, and then whenever I move my hands from the console on the left, it moves exactly on the inside, and it moves just like the human wrist, as you could see it rotate left, right, up, and down. And I look through this as a 3D high def, so those instruments you're seeing actually are 5 millimeters long and about 2 millimeters wide. And what you're looking at here is when I move my hands inside of those little pinchers, the robot mimics that exactly at the same time. That needle is just bigger than the size of a human hair, and the suture is smaller than a human hair, and it allows us to do microscopic surgery.
Wow. How long does that procedure take?
We're less than an hour, and about 45 minutes on average, depends on the size of the uterus. And I'm confident, as many people in the nation are, down to 25 minutes for the surgery.
That is great.
Yeah.
Dr. Cly, thank you. I believe we have a caller on line 1. Sandra, are you there with us?
Yes, I am.
Okay, please pose your question.
My question is, I am about 32 weeks into my pregnancy, and about a month ago I started to experience just some difficulties with slight bleeding, and then it would stop, and then later on, maybe a couple weeks after that, it would start back, and it was described to me as being old blood, and I just want to know what may cause something like that, because it would go on for 2 to 3 days, then it would just stop completely, and then maybe a week later, I'd be going through the same thing again.
Sure. Thank you for your question. It's very common. Usually it's not a problem. And what I would recommend, number one, is check with your doctor. Make sure he or she knows that you're having these symptoms. Many times it's some irritation from the cervix. So there is a little bit of bleeding inside the cervix, not near the baby. And it just takes a day or so to come out. And by the time it comes out, it's a brownish color. It probably is also would be a good idea to check to see if you've had an ultrasound recently, to look near the cervix, near the baby, and make sure there's nothing else going on inside where you can't see.
Sandra, thank you for your call. We do have that telephone number on the bottom of your screen. Please give us a call with your question. Okay, there have to be some type of drawbacks, because typically with any type of surgery, there are drawbacks. Sure. What are they with this type of procedure?
Oh, absolutely, and it's very important that we make sure that the patient who is undergoing surgery is appropriate, meaning why are we doing the procedure? And because any time a complication could happen, there's very few with this procedure, but we have to just keep that in the back of our mind. So that's the first thing. Make sure that the benefits outweigh the risk, and that if she had this procedure, that her life will be improved and the symptoms will be taken care of.
Okay, so paint us a picture of the ideal candidate.
Someone who's bleeding and fibroids or in cramping or pain are affecting their life to the degree that it causes significant disruption. Could be as much as missing work because of your period every month, or affecting your reaction and relationships with your family because of how you feel every month. Those are just two examples from being anemic and needing a blood transfusion because you're bleeding so much every month. So there's a wide array, but usually I try and say when it's affecting you to the point that you're not functioning normally, that's when you should talk to your doctor.
If a woman chooses not to have this procedure, what are her options?
I would tell her to go with, if she does not want a surgical option, to go with some type of a medical treatment with pills or medication to help control her symptoms. Many times if a patient can make it to the menopause years, the fibroids will decrease by 1/3, and many times the symptoms will decrease enough where the life and their symptoms won't be interruptive.
That's if you can hold out.
Exactly, exactly.
All righty. Let's say that, is there any guarantee that this surgery will work? Is there a chance that the fibroids may return with this surgery or with a hysterectomy? Or?
That's a great question. If it's a myomectomy, meaning we're removing the fibroids, it usually is a short-term gain, because at some point those fibroids will grow back or new fibroids will grow because we've left the uterus in place. And that's usually trying to achieve a pregnancy, trying to remove them for the pregnancy. If it's a hysterectomy, then they will not come back because they are within the uterus, and once we take the uterus out, there's no way for them to come back.
In terms of the Da Vinci procedure, how many have you personally done?
26 so far, and I usually reserve the Da Vinci procedure for the complex hysterectomies. A lot of people in town, and myself included, perform a laparoscopic hysterectomy on a regular size uterus without significant challenges or adhesions inside. And that does very similar to what we saw without the extra technology. So the complex hysterectomies, people who were being told they would have to have an abdominal incision, those are the people who are perfect for the Da Vinci, because now they don't have to have an abdominal incision. They don't have to be off work for 6 weeks and in the hospital for 3 days. They can go home the next day or same day.
Is there an age restriction on the procedure?
No, no age restriction, none at all. And it actually is for people who have more medical problems. Having the Da Vinci procedure instead of a large incision is much better for diabetes, heart problems, lung problems. Their body's not being invaded, so to speak, as much, and they don't have to recover as much, and that way their other health problems won't cause as many issues.
When a woman comes to you, you've done 26 of these procedures. Mm-hmm. What does she share with you in terms of her greatest fear about this procedure?
Sure. Most people's greatest fear is just being put to sleep for surgery. That's a big fear, and it makes sense, because when we're asleep by medical reasons, we're out of control.
Right.
That's the biggest fear. The other fear is bleeding and pain. And the nice thing I can tell them is this procedure minimizes bleeding. We're losing, on average, teaspoons of blood instead of pop cans of blood. Because we're so small on the instruments, we're able to stop bleeding as the first drop comes out, and that also changes the recovery, because women aren't fatigued and tired because of losing so much blood during surgery.
Let's say you have someone who is scared to death of surgery, who really doesn't want to take medication either. Is there anything that she can physically do? Or let's say, are there any types of foods she can take to lessen the pain of fibroids?
Some of the medications we can try that will help lessen the pain and lessen her symptoms. One thing, weight loss will help, because with less extra adipose tissue, there's less hormonal conversion, which will decrease the amount of bleeding each month. Now, that's realistically a hard one for many people to do, mm-hmm. but it's something we do mention to them.
If you don't get anything done, what other types of problems can fibroids cause?
What happens is they get large enough and they then can bleed, and many times people will become anemic and their blood volume will be so low, mm-hmm. they'll be fatigued and tired, and they could be at risk for a heart attack or stroke. And usually we see these people show up in the emergency room and they need 2 or 3 or 4 units of blood immediately because they're so low.
In terms of Fort Wayne, are you the only person who does this procedure here?
A good question. Right now I'm the only one who's done 26. One of my partners has done 2, and many of my other partners are training. And again, with the laparoscopic hysterectomies, for the routine hysterectomy, most docs in town do that. It's the complex ones that need an abdominal incision is where the Da Vinci comes into play. And I'm trying to spread the word to the patients. So if their doctor's saying, you need an abdominal hysterectomy, I want them to say, well, doctor, can you do a Da Vinci procedure? Mm-hmm. And by having the patients spread the word, it'll encourage more doctors to learn and to use this, and the patients will benefit.
Dr. Cly, we have another caller.
Okay.
Carl, are you with us?
Yes, I am.
Okay, please pose your question.
I was wondering if the Da Vinci machine that you showed earlier, I was wondering if that can be used on any other procedures.
Great question, Carl. It sure can. And right now it's being used for prostate cancer here in town, and it's a phenomenal machine and technology for prostate cancer. It's also being used for cardiac or heart bypass graft surgeries. And that's also an amazing procedure, because no longer do you have to have a huge incision and your sternum opened up. That greatly diminishes recovery time. Some general surgeons in town are learning to use it for colon procedures or GI procedures. So it's starting to take off, in a lot of different specialists, and surgeons are learning how to do even more minimally invasive surgeries for their patients.
And insurance covers all of this?
Yes.
Or?
Yes, it's currently charged at the same rate mm-hmm. through the insurance. The hospital, there's a lot more cost to the hospital, but they look at this as a technology that benefits the patients and benefits the public, and they're taking a little bit of a loss, but on the other hand, the patients are so much better in Fort Wayne.
Where do you see this procedure going, let's say, in 5 to 10 years from now?
Great question. I think we're seeing the beginning of a revolution. The same way in the early 90s we saw appendectomies and gallbladder surgeries go from this open incision to this teeny-weeny laparoscopic incision. Mm-hmm. And now if your doctor said, I'm going to take your gallbladder out and I need to make a big incision, you're going to say, wait a second, doctor, I want the small incisions. And I see the same thing happening with the Da Vinci technology to revolutionize so that patients are going to benefit from it.
I am just amazed at the video we saw earlier. You said it's the size of a human hair?
Yeah, the suture, the stitch they were using was the size of the human hair. The end of those clamps was 2 millimeters, and they were only 5 millimeters long. The other nice thing this machine does is it removes any shakes or tremors. And so even if I've had a lot of coffee that day, I still don't have any shakes. And then it also can minimize my movements. Just kind of like driving a car on the highway at 55, you can't turn the steering wheel as much because it knows you're going that fast. So if I go like this, I can tell the machine just to go a little bit inside so that I won't move too much inside the patient.
That's incredible. Have you ever had any person who really needed the surgery and chose not to get it?
I had one lady.
She was kind of stubborn about it, yeah.
I did have one lady. She chose not to get it. She did have some complications with her incision becoming infected. And she told me later, she said, I wish I would have done that. And she was more just really, really scared of something different. And she had heard her other family members had had the old procedure done with the larger incision. She's doing well, but it did take a long time for that incision to heal.
Okay, to prepare women for this type of surgery, do they have to take a special class? Do you guys have counseling sessions? How does all that work?
Good question. I usually try and have them educate themselves initially on the internet, talk with their family members, have them come in and talk with us. And then we have risk and benefits video. We have nurses in the office who they go through a whole setup of pre-surgical instructions and risk versus benefits. And through that we educate the patient and we make sure that the patient is having the right procedure done.
Now getting back to hysterectomies, how many are performed a year?
600,000 hysterectomies are performed a year. And only 200,000 are minimally invasive. Still 400,000 of those are done with the large abdominal incision. By using
when we say large, how large?
About the size of a C-section incision.
Okay.
And people stay in the hospital for 2 to 3 days. I've found in my practice by incorporating the laparoscopic surgery and the Da Vinci, I'm about a 99% minimally invasive hysterectomy rate. So I do less than 10 abdominal hysterectomies a year. And that's why I'm trying to spread the word, because if all doctors started to incorporate this technology, patients would benefit because there wouldn't be as many of these large incisions, 2 or 3 days in the hospital and 6-week recoveries. We can get people back to normal sooner.
Now speaking of that, are a lot of doctors aware of this new procedure?
Yes. Yeah, and there was a big meeting a couple months ago, and they brought the robot to educate most of the doctors in Indiana. So everybody's aware of it, and we're trying to get the word out.
Okay, how many actual machines are there here?
There's 2 machines in Fort Wayne.
Okay.
There's only 500 in the whole country. So we are very blessed, and it's very nice to have such technology in such a small town with just a small number in the whole nation.
Are you going to lead a class?
Actually, that's one of the things
You're working on that? Okay.
Yeah, I've been doing.
How many people are actually signing up for that?
For the to be taught?
Yes.
Oh, there are more and more every day. We have 6 in our group who are learning right now. I've been asked to come to South Bend and around Indianapolis region to help teach other doctors. So it's catching on very rapidly.
So when a woman goes to her OBGYN, she says, I have a lot of pressure down here. Do you think I have fibroids? What's the next step? How can you actually tell if she does?
First is the exam, history first, like you just mentioned, then the exam in the patient room. And then after that, usually an ultrasound, depending on what the exam shows. And the ultrasound for sure will tell you how many are there and what size they are. And then from there we make a decision if a person needs a hysterectomy or if we can manage it with medicines or if they'd rather manage it with medicines.
I'm going to get personal here.
Sure.
When I was a teenager, I had really, really bad menstrual cramps. And I wasn't sure if I had fibroids or not. Let's say you have a teenage girl.
Right.
She has incredibly intense menstrual cramps. She fears she might have fibroids. Have you guys ever had cases like that when you have a teenager?
Oh, yeah. Yeah.
What do you do in that situation?
Sure. And usually at that age, it's usually not fibroids. It is a couple other conditions that we can treat. We always try to first manage with medicines and non-surgical methods. And then if those aren't enough, or if the only way possible is to do surgery, many times we can do surgery, still keep the patient's fertility and ability to have children in the future, but just trying to treat the symptoms at the time.
Is the surgery recommended for someone who's, let's say, under 20?
We usually recommend, in general, for taking hysterectomy to try to make sure the patient has had her family first, if at all possible. And usually less than 20 would be extremely young. It is theoretically indicated for some people, but we would try to encourage them to try to figure out their life so they could have their children now, delay any possible surgery until that's done.
If a woman chooses to have a hysterectomy instead of the Da Vinci procedure, she can expect to stay in the hospital for how long a period of time? For
abdominal hysterectomy, 2 to 3 days. And usually that, because of that incision, we have to have them not go back to work for 6 weeks. We ask them not to drive for 2 weeks so that they don't put too much pressure on the incision when they're driving.
Okay. Not counting the incision, what are, if we had to put them both side by side, let's weigh the risk and the benefits for each.
With the abdominal surgery in general, there's more risk because of more instruments going inside the body. There is more blood loss. There's more risk to damaging the ureters, which come from the kidney. More risk for an internal infection. Those are your bigger risk with any type of abdominal procedure.
I believe we have another caller. Nick has a question for us. Nick, go ahead.
Yes. Am I on the line?
Yes, you are. Go ahead, Nick. Go ahead.
Right. On a prostate that a person would have, there's an operation called TURP. Can this machine be used to do that procedure?
That's a great question. This machine, it would be used mainly for prostate cancer right now, and the goal is trying to remove the cancer from around and within the prostate. So the TURP is a transurethral procedure, and I'm not a urologist, so I don't have the specifics on that procedure, but that procedure goes through the urethra to open up that passageway. So I do not believe they are interchangeable based on the reasons why someone has a TURP done versus a prostatectomy for cancer.
Nick, thank you for your question. For those viewers who are just joining us, Dr. Cly, let's once again talk about how the Da Vinci surgery can also help with other types of medical problems, not just fibroids.
Yes. The Da Vinci surgery, again, using the small instruments, is taking the prostatectomy, which used to be a pretty large and invasive operation, to a minimally invasive operation, and patients are going home, I believe, the next day. And they can have that cancer completely removed. And because of the smallness of the instruments you saw, the urologists are able to get very, very close to normal tissue and get all that cancer cells out and spare a lot of the normal tissue, because they can get down to 1 millimeter and 2 millimeters instead of, taking out extra tissue that's normal that they couldn't see or couldn't get as high def or close with.
Okay.
And for heart bypass grafts, now you don't have to always have your chest opened up, which is a lot of pain, a lot of recovery. They can do it through these small incisions, which are 5 or 7 millimeters, and the patient can recover right away.
I'm just amazed at the video we saw when we were talking about the problems that women face with their fibroids. And you actually showed the machine going in there and just working its magic, literally. How long did it take for you to really master that machine?
It actually, for gynecologists, it's kind of easy, because we've been doing laparoscopic hysterectomies for a while with instruments that aren't as flexible, and we have to kind of work with our hands up high and work almost like we're in a mirror looking backwards. And so once actually we got to be able to use the robot, it makes the hysterectomy easier for me, because now when I move directly with my fingers, the robot does the same thing, whereas in the past I'd have to move my hand to the left in order to get the instrument to move inside to the right.
We have a caller who doesn't want to be on air, but wants me to read off their question, asking, what if fibroids grow back?
It's a great question.
Thank you.
Sure. That's a great question. And fibroids will grow back. If you've had a myomectomy or the fibroids removed, those fibroids are gone. But traditionally, if you're someone who has fibroids, your uterus is going to make more fibroids. And again, we talked as if you can make it to menopause. If you have a procedure done and you're close to menopause, you might be lucky enough that when you'll get to menopause before they grow back, and if a few of them started to grow, they'll shrink by 1/3 at menopause and hopefully not cause any symptoms. You could have another procedure to remove fibroids. And there are some non-surgical procedures where the radiologists go in and block off the fibroid blood vessels so that they will shrink up inside. And that's a good procedure for if you have a few fibroids. Once you get above 3 or 4, that procedure is not as good.
Okay. Thank you, caller, even though they didn't want me to actually say their name. And Dr. Cly, thank you very much for joining us tonight.
Thank you.
Interesting topic. Well, here's a look at what is coming up on future Healthline programs. Next week, your regular host, Lee Kelso, will be back. On the 24th, his topic, cancer care, with special guest Dr. Carol Westbrook. And on the 26th, Lee will talk with Dr. Kevin Burning about cosmetic surgery, specifically body contouring, liposuction, and tummy tucks. So be sure to tune in next week for both of those shows. That does it for this edition of Healthline. Thanks for joining us and have a great night.